Hello and welcome to the physiotherapy section of this presentation. My name is Katie Hayes. Myself, Colin Dunleavy and Emer O'Malley are the physiotherapists you will meet when you come to our service. I hope to provide you with an overview of the role of physiotherapy and how we might help you along your journey. You may find you have been sitting for some time while listening to this long presentation, and we do encourage you to move around as a way of feeling good. You may have already seen this slide during this presentation, and you may very well see it again. The reason for its recurrence is it portrays nicely how we approach the disease of obesity at our Centre for Obesity Management. We know obesity is not simple, and it is not just about food. This image portrays how things link together and how important it is to have a wider look at all different components involved in caring for yourself. One aspect of that is physical activity and movement. And I wonder if I could just ask you to stop and reflect for a moment. When you think about being physically active or moving around, what comes to your mind first? Do you think of movement and physical activity as a debt that must be paid, something that we need to do in order to burn calories? Or does it make you think of being in pain? Do you think of hardship and associate it with being short of breath? The last picture is hopefully our approach to physical activity and movement, so something that isn't associated with hardship and can be enjoyable. So, as you're starting to think about your own activity levels and possibly building on them, it can be helpful to think about why activity is important and why it is good to move. Sometimes people can fall into the trap of linking specific exercises for specific durations to specific calories burned. So, for example, if I eat a meal that's X amount of calories, I need to exercise for X amount of time to burn those calories off. The reality is that this relationship is not linear and it doesn't work that way. And so it can be a really unhelpful way to think about the reasons for routine engagement in physical activity. So instead, we think about physical activity and movement as part of the best health and best weight puzzle. There are several parts of the puzzle that we hope to address with you and to help you fit these pieces together as best you can. In your physiotherapy sessions, some of the things we will address will include physical activity levels, sleep, pain, and other healthcare issues as appropriate to you. Approximately 90% of people attending our service are living with pain. Pain is a barrier to engaging in routine and enjoyable physical activity. There are mixed messages around this. Often people are led to believe they need to push through the pain, and this really isn't helpful, and we take a different approach to that. Breathing and shortness of breath can also be a challenge for people when moving around. Others feel, again, maybe through negative messages in the media or even through friends and family, that if you're not out of breath, you're not working hard enough. This, again, is a very unhelpful way to approach your relationship with physical activity and something we would hope to address. We know that moving around at a moderate and comfortable pace is associated with so many health benefits. We will aim to practice some simple strategies such as breathing exercises, positions of ease, and pacing if this is a problem for you. Something else we may discuss with you in your individual session is the use of mobility aids and supports. So this describes equipment such as walking sticks or what you can see in the picture here, which is the bariatric seated rollator. Again, depending on your own personal challenges, we might recommend something along these lines. Sometimes people may not welcome this idea because of the perceptions that can come along with using a mobility aid. However, we believe they can be a really helpful tool that can open up the world and allow you to do things that are important to you. Particularly with the seated device, you know your seat is with you, so you don't need to worry about where the next seat is if you need to sit down because of pain or fatigue or feeling short of breath. Another issue that's common to approximately 20% of our patient group is this issue of swollen legs or obesity related oedema. This can be associated with recurrent cellulitis, which is an infection you can get on the skin, which is shown on the image on the left hand side. A very successful treatment of this issue is compression stockings that you wear below your knees. So, if this is something that affects you, we will discuss the best management approach for you at your individual sessions. Another very important area we will look at is your relationship and unique challenges that you may have with sleep. Good quality sleep is important for general health but also plays a role in obesity management. Obstructive sleep apnea is a common breathing disorder that affects many of our patients. Using a CPAP, so continuous positive airway pressure machine, which is the machine in the picture here, is the most effective way for managing sleep apnea. And if this is relevant to you, we will work with you to support you on this journey. Self-monitoring or tracking what we do can be really useful when we are taking a closer look at our behaviours. It can help with maintaining consistency and it can help as we are making changes. Tracking your activity levels is something that we encourage. One way to self-monitor physical activity that has become very common is through a wearable device such as a Fitbit or an Apple Watch. These devices can record a whole array of things around movement and our heart and sleep, and it can actually become quite confusing as to what's important. We would advise, if you are using a device, to keep it as simple as possible. Steps per day is a good way to do it because it's something that can accumulate throughout the day. Particularly if you are struggling with pain, it can be helpful to show the little bits adding up. So, how many steps a day should I do? There is this notion out there of 10,000 steps. We would encourage you to stay away from that idea. Everyone will have their own unique step value, a number that is realistic for them. So we don't want to get too fixated on what others are doing. We would often get asked which device is best. So we would advise sticking to the main brands is probably a good idea. Some of the cheaper, less known ones can let you down. Batteries can go flat. It can be troublesome to get them to sync to your phone. So probably better off to sticking to a better known brand if this is something you're interested in. While technology can be helpful, it is not absolutely necessary. There are other forms of self monitoring, including using diaries or just monitoring it yourself. There are other aspects of our lives and habits that may be helpful to take a closer look at and use other forms of self monitoring. For example, screen time. So, how many hours a day are we spending watching telly on our phones? Do we know what that is and how best to break it up? Looking at our sleep time. So, do I get to bed and get up at a certain time? These are very important foundations for managing our daily activities. And if they are routine, people tend to do better with their activities during the day. You can also look at how many minutes was I sedentary for, how many minutes was I sitting for today. It can also be nice to record how you're thinking and feeling during the day. So, the next step after today is you will be invited to attend as an individual. Prior to that appointment, you will receive a phone call from one of the physiotherapists to go through some questions over the phone. On the day in person, we will complete a thorough assessment, which will include you and your story. We'll also carry out some functional movement tests, but these are not maximum stress tests and will be tailored to you as an individual. We hope to learn about you and where you are on your journey right now. Things might be challenging for you at the moment and it is a good time for support, or things may be going quite well for you at the moment and you are already linking positive behaviours together, moving towards best health and best weight. Sometimes we find people are doing this and don't realise it, and we hope to support you on this. When we asked other people who have attended our service what they would like you to know, what they told us was little and often adds up. My pain is easier and I know what to do. I don't get out of breath as much. I can leave the house. I'm feeling better and I'm sleeping better. I'd also just like to highlight the ICPO, which is the Irish Coalition for People Living with Obesity, who are a patient support and advocacy group. They do great work, and many of our patients have found them to be a really great and helpful resource. We hope that your time with us will be about piecing together your jigsaw of best health and best weight. Thank you for listening, and we look forward to working with you.